As I'm new here, I will just tell a few words about my work, and thank you, Gunther, for inviting me. I'm very impressed about this potential of this network. I'm a gynecologist, obstetrician working in Riga, and I have a special clinical and also scientific interest in female sexual health, sexuality, and dysfunctions. And 2 years ago, I attended ESSM School of Sexual Medicine, and after that, I started to work in a first team in Latvia as a clinical multidisciplinary team for sexual dysfunction. So this is also my daily work, and also I'm lecturer in the university, and I'm one of all the pieces of the puzzle, also teaching the sexual medicine. And in our university, it's a level B, so A topics are compulsory, B and C the students can choose, so only some part of the students can attend it, and it's always full and crowded, and students are really ready to have this information. So thank you. I'm really personally interested for this curriculum, and I hope we will be the part of maybe implication in our university. But today I want to tell about the results, what we have done together with many countries. It was a very interesting research. Since the start of the pandemic, there were a lot of people they were under complete or partial lockdown, and sometimes with even unwanted company. And almost all domains of lives have been affected, and sexual life was not an exception. And all three domains actually could be potentially change, of course, biological because of disease itself, of course, sociological because of the distancing, and also psychological. And during the first wave, we saw that there are a lot of complaints and problems coming out from society, and people are really feeling distressed, and we felt that we need research about that, and we started to figure how we could do it. And at the same time, the Answer Network also felt the same and also started to think, and they came up with the idea to do it in 30 European countries with the same questionnaire, with the same questions, and we are very lucky to be part of that. And it happened actually in a very short time, and the questionnaire was online, it was translated in all languages, and we took out only one part from 13 items because we don't have a female genital mutilation almost at all in Latvia, so we couldn't gather data about that. But all the other aspects of sexual reproductive health were covered. And this was a study conducted from the July to October 2020, and it was at the same time a multi-country study with the name iSure from the Answer Network, and also in Latvia it was also the state research project. So the state was waiting for results, and we had to report what we have found, and also later we saw how much it was actually taken in account what we have found. And it was a behavioral cross-sectional online survey with convenient sampling, and it was combined with qualitative research of structured interviews with the healthcare providers and leaders of governmental and non-governmental organizations, which was also interesting experience for us to join both methods, and also how to really do it in the case of the lockdown, how to get informed consent forms, and how to perform interviews, so we did it via Zoom. And of course, today was approved by the ethics committee, and the inclusion criteria included 18 years or older currently living in Latvia, and it was self-administrated online questionnaire, and we had 1,173 respondents, and 12 aim group discussions, and 13 structured interviews. And about the definitions, in Latvia, first wave started at 13th of March and ended at 9th of June. So that was a full lockdown. And in Latvia, there was, which is also very important, during the first wave, there were restrictions to attend the doctor for planned visits, and also restrictions to get, for example, any consultations which are not urgent. So it means everything about contraception, abortions, and any planned medical consultations were not allowed. And so what we got in results, most of the responders were women, mainly speaking in Latvian language, because we have some also speaking in Russian. Age group, mostly they were younger people, up to 40 years, but this we explain because of this methodology, because they are more active in networks, and they could, but also we had the printed invitations and send it to other places, not only in the capital. And most of respondents lived in the Riga, but it also corresponds with the real situation. Most of the people really live in the Riga. And when we talked about sexual activity, for more than half people, sexual activity didn't change during the lockdown, and there were approximately the same amount for those who told that it decreased, and approximately the same amount told that actually the sexual activity increased. And women showed a statistically significant decrease of satisfaction with sexual life when comparing to the men. When we were asked how to explain it, it could be because in many families women are very responsible for everything, to take care about the children and food and work at the same time. And actually those families being in a lockdown all together, children in online learning and parents in an online work, it actually was a very, very stressful situation for a lot of families. And women were less likely to have casual sex before COVID, and they noted no change during restrictions. About tension in a relationship, more than one-fourth of all respondents told that they had a little bit or extremely increased tension during this period in a relationship, and results showed correlation as this tension increased, dissatisfaction with sex life also increased, which is quite logically, and also when tension increased, the sex frequency decreased. Talking about the children, approximately half of respondents didn't have any children, and half had from 1 till even 5 children in families. And then we noticed that people who didn't have children more often were dissatisfied with their sex life during COVID-19. Which is also interesting why, but we mostly see it because it could be related to the partnership issues. So it could be that people having children have also the partner, so they have opportunity for sexual life. And during lockdown, for those who didn't have a partner, it was much harder to meet new partners. And people who increased alcohol consumption during restrictions were less satisfied with their sex life. It was very interesting to compare among the countries. Others as well had results. There were some countries where alcohol consumption wasn't possible, it was forbidden during the COVID. In Latvia, it was the opposite. The shops actually started even to bring it home, just with the online marketing. So actually there are quite a lot of people who increased alcohol consumption during this lockdown. And respondents who were married and lived together were more satisfied with their sex life during restrictions than those in a relationship but not living together. Explanation could be the same because of this possibilities to meet a new partner. For most of women, restrictions didn't affect availability of contraception. Those are the data from the what we had online information. In the next slide, I will show data from the interviews. And the factors that stopped women from obtaining contraception was because of doctor was not available. Sometimes they had a fear to get COVID if they would go to the healthcare facilities. Sometimes they told that long waiting time, and sometimes chosen method was not in stock or not transport available. I would say that Latvia is not with a high percentage of highly effective contraception usage. When we ask people and have some studies, dominantly it's a condom actually. That's why could explain why it was available in the shops and pharmacies. But from the interviews, president of Professional Gynecological Association told that accessibility of contraception was certainly more restricted because the scheduled doctor's appointments were not allowed, and those women who had stable or long-term relationships with their doctors, they were able to resolve it because they just made a call or wrote a message that they need additional prescription. But for some, this wasn't so easy, and essentially condom accessibility was not limited because the shops and pharmacies were opened. And head of NGO of Sexual Reproductive Health told that we cannot think of healthy family life if women cannot have the opportunity to live their sexual life fully using the contraceptive. And about the violence, this was a topic where we actually saw the much controversies. Those here are data from the questionnaire. First three are about the women, and last about three about the men. And first is before the COVID, and the darker one is during the COVID. And we see from the questionnaires that emotional violence decreased, physical violence decreased, sexual violence decreased, and the same in a man, which is a little bit suspicious. How could it be? And when we had discussions, interviews with organizations, then we had information that it was a very, very difficult time, and when public authorities had to be convinced not to cut a service that was not already fully funded also before, because all those services for violence victims also were locked down for that time. And they told that there were twice as much women who asked for help as it was before restrictions, and cases of violence were extremely cruel, including sexual violence and even death of the woman. And conclusions that sexual life was ongoing and is ongoing also during pandemic time, but many aspects of sexual quality of life and relations were influenced by restrictions, especially among women. And it is especially important to recognize possible risks of violence. There were very different information from different countries about violence, and some of countries had the same results as we, but they explained that they had this alcohol lockdown as well, and they think that decreased the violence. About our data, we think that it is like the problem of the method, that by this method we actually didn't reach the victims, because they are usually locked from the outside, and during this time they were actually locked with their perpetrators, and could be that some researcher group advertising something in the internet, we just didn't reach them. So that could maybe explain those controversies. And what is very good, we also wrote a report because it was a governmental study as well, and there was a lot of information about women who really suffered because they couldn't have deliveries with the partners. It was also not allowed, and now we have already third wave, and at the moment there's actually highest ever incidence of new cases, but still the partners now are allowed in deliveries. So actually we could change at least something by our results. Thank you for attention. And are there any questions?